Stop what you're doing for just a moment. Before you flush the toilet again, I want you to pay attention, really pay attention. What comes out of your body every day is trying to tell you something. Something vital. Something that could make the difference between catching cancer early or discovering it too late. I'm Dr. Jocelyn, and for the past 5 years, I've helped seniors understand the subtle signals their bodies give before symptoms escalate. And here's a truth most people don't hear. The deadliest warning signs don't scream, they whisper. They hide in the small, often overlooked changes you might dismiss. Maybe your stool seems a little off, a shade lighter, a bit thinner, or sometimes darker than usual. And maybe you ignore it. I see this all the time. Patients come in months, even years, after noticing changes, hoping it's nothing. Sometimes it's far more serious than they imagined. Let's bust the first myth immediately. You are not powerless because you're over 60. Your digestive system is not just old. Your body communicates constantly, and stool is a window into your gut, liver, pancreas, and yes, even cancer risk. By the end of this video, you'll feel confident decoding the signals your body sends and knowing when to act, empowering yourself to catch issues early when interventions are simpler and more effective. Before we dive deeper, do me a favor. Hit that like button if you care about your health or the health of someone you love. Drop a comment below. Where are you watching from? Your journey is personal, but you're not alone. And make sure to subscribe so you never miss life-saving advice. Here's why stool is such a powerful health signal. Every bowel movement is like a daily report card for your digestive system. If you ignore it, you're throwing away clues your body has been leaving for months, sometimes years. Think of stool as a story. The shape, color, consistency, even timing, all reveal what's happening inside your intestines, liver, pancreas, and colon. It's not waste, it's a medical report. We doctors often use the Bristol Stool Scale, ranging from type 1 hard, small pellets, to type 7 liquid diarrhea. Most healthy adults fall in the middle, smooth, soft, formed, and brown. Type 1, constipation. Waste stays too long, causing inflammation, colon strain, and hemorrhoids. Type 7, diarrhea. Food moves too fast, nutrients aren't absorbed, body may be dehydrated, and chronic cases can hide infections or even cancer. Here's another myth. Frequency matters just as much as consistency. Ideally, bowel movements happen once a day, around the same time. Sudden changes less frequent, more frequent, or irregular are a red flag. Let me share a real example. Mrs. Thompson, 68. Regular bowel habits her whole life until she noticed thin, pencil-like stools and a persistent feeling of incomplete evacuation. She ignored it for months. By the time she came in, polyps were progressing toward cancer. Early attention could have prevented her risk entirely. Let's go step by step. These are warning signs that demand attention. 1. Pencil-thin stool. Repeated thin stools may signal narrowing in the colon. Causes can be low fiber, inflammation, or a tumor. Always note changes from your normal pattern. 2. Incomplete evacuation and tenesmus, feeling like you haven't fully emptied your bowels. That's tenesmus, often caused by inflammation or obstruction. Common in older adults, it's never something to dismiss. 3. Black, tarry stool, Melena medical emergency. Black sticky stool signals bleeding in the upper digestive tract, stomach, small intestine, or esophagus. Causes include ulcers, diverticular bleeding, or cancer. Go to the ER immediately. 4. Bright red blood visible on toilet paper or mixed with stool is serious. Sometimes hemorrhoids, but colon, polyps, or cancer are possibilities. Early detection saves lives. 5. Yellow or pale stool, clay colored or yellow stool, can indicate poor fat digestion, liver issues, or pancreatic problems. Persisting over 2 to 3 days, contact your doctor promptly. 6. Sudden pattern changes. Even normal-looking stool with sudden frequency or consistency changes can signal trouble. Don't ignore it. Knowledge only works when acted on. Here's how to protect your gut and reduce cancer risk. Strategy 1. Daily movement. Your colon relies on movement. Gentle walks, stretching, or 20 to 30 minutes of daily activity stimulate intestinal contractions. Strategy 2. Colonoscopy screening. Everyone over 50 should have at least one. Early detection removes polyps before they turn cancerous. Strong family history? Start earlier. Strategy 3. Nurture your gut microbiome. Your gut houses trillions of bacteria aiding digestion, vitamin production, immunity, and even mood. Protect them by avoiding unnecessary antibiotics, eating probiotics, yogurt, kefir, sauerkraut, kimchi, eating prebiotics, onions, garlic, leeks, asparagus, apples, bananas, oats, seeds, vegetable skins. Strategy 4. Hydration and fiber water jumpstarts bowel movements. Start the day with a glass of water. Add fiber gradually. Chia, flax, prunes, kiwi, papaya. Observing stool isn't gross, it's empowerment. Every bowel movement is a chance to protect yourself. Start simple. Observe stool daily, note changes in color, shape, or frequency, act on red flags misses. Thompson's story proves it. Pencil-thin changes caught early led to treatment before serious risk. Small habits compound. Hydrate, move, feed your gut microbiome, monitor stool. This isn't fear, it's proactive protection. Here's the truth. Age is not the end of vitality. Even after 60, you can improve digestion, prevent disease, and protect against cancer with small, consistent daily actions. Today you've learned. Stool is a window into your health, which changes our warning signs, how to protect your gut and microbiome, why early detection and daily habits matter. Start today. Observe, hydrate, move, feed your microbiota. Share this knowledge with friends or family over 50. Empower them. If this video helped you, hit like, leave a comment telling me where you're watching from, and subscribe for life-saving tips. I'm Dr. Jocelyn, and I'll see you in the next video. Remember, you're never too old to protect your body, your dignity, and your life. Small changes today compound into lasting health tomorrow.